So we finished doing traction with his neck in 5 degrees of extension, and we did that for 3 minutes. And he commented that before, when his neck was in extension, it felt real tight. And how does it feel now?
Not as tight.
Very good. And now we have traction, mobility, and extension. So I can take up the slack freely, and I can do traction, and there's movement all the way down to your feet. Now I'm bringing you back in neutral. The other thing I noted a while ago was that the sulcus is not as deep underneath the mastoid. And I can now shear C1 laterally to the right, and I can shear it to the left as well. And if I flex you slightly, so I can get underneath the occiput, and I find that prominent spinous process, which is C2, and I come above that, and then I can lift C1. I can get a little bit of anterior glide of C1. So that is the rare presentation of what I call a hyperflexed atlantoaxial joint. And that's the treatment, to do gentle traction for 3 minutes with the neck only slightly in the direction of resistance, which would be 5 degrees of extension. It's a one-time treatment. You will be able to maintain that motion. And this is a device that I endorse. It's $30 on Amazon. Do not pay less. Do not buy the $10 item, because it's a bait and switch. So make sure it's the $30 unit. It's called Dr. Ryder's Real Ease, and his last name is R-I-T-E-R apostrophe S, and then Real Ease neck cradle. And so the curved part goes under your neck, and it puts your head and neck in a fairly neutral position. And it reduces motion in the mid and lower cervical spine, and it makes it really easy for you to isolate the upper cervical spine. So in this device, I'd like you to practice extending your head. Good. Just go back and forth, little tiny extensions. And I'd like you to do 30 a day for a week. And then at least once a week, do these exercises. Then, after that, take your head in extension. So, yep, arch your head back. And then with both hands, you're going to capture your temples, and you're going to push towards me, or towards the crown of the head. And just take up the slack, take up whatever movement you can get there. Keep that mild force there, and do that for 3 minutes once a week. Okay? And there's a couple other exercises. I have a YouTube video. Type in my last name, H-E-S like Sam, C-H, upper cervical exercises, and you'll see a few other exercises you can do in this device. It's a nice device because it lets you isolate upper cervical motion in the upper 2 joints. So thanks for letting me film you. I appreciate it.
You're welcome.